Depression in older adults, a complete medical guide. Depression in older adults is a serious medical condition that affects a significant portion of the population over 60. Unlike the natural sadness that can accompany the losses of aging, clinical depression is a treatable illness, not a normal part of getting older. Understanding the reality of the numbers, recent studies reveal concerning yet hopeful data. Globally, a substantial number of older adults live with depression and anxiety. This prevalence is high across many nations and increased significantly during the pandemic, but these challenges also highlighted the resilience and adaptability of seniors. Women are more affected than men, and factors such as living alone, lower income, and multiple chronic illnesses increase the risk. Crucially, while a large percentage of seniors with depression, often over 70%, have at least one concurrent physical illness, this doesn't mean depression is inevitable. It means we must treat the whole person. Recognizing the unique signs in older adults, depression in seniors often presents differently than in younger people. Many older adults don't experience classic sadness, but rather what is sometimes called depression without sadness, characterized by a loss of interest in pleasurable activities, extreme fatigue, and problems with memory and concentration. The most common symptoms include difficulty sleeping, loss of appetite, vague physical complaints like body aches, excessive worry about health, and a general feeling that nothing is worthwhile. Unlike younger individuals, depressed seniors may exhibit more agitation than slowness and more anxiety than verbalized hopelessness. A critical warning sign: when memory difficulties appear alongside other depressive symptoms, it may be depressive pseudo-dementia, a cognitive impairment that improves completely with proper treatment for the depression. Distinguishing normal sadness from clinical depression. It's natural to feel sadness in the face of loss, the death of a spouse, physical limitations, or retirement. Normal sadness is proportional to the loss, gradually improves with time, and the person maintains some ability to find pleasure in certain activities. Clinical depression, on the other hand, persists for weeks without improvement, severely compromises the ability to function day to day, and completely removes the capacity to feel joy or pleasure. When an older adult can no longer take interest in anything they once enjoyed, cannot care for themselves, or expresses thoughts of death, we must act quickly. Evidence-based treatment approaches. The good news is that depression in older adults responds very well to treatment, often better than in younger people. Seniors tend to have better adherence to treatment and lower dropout rates. Effective and safe medications. The safest antidepressants for older adults are the selective serotonin reuptake inhibitors, SSRIs, especially citalopram, escitalopram, and sertraline. These medications have proven efficacy. About 45 to 53% of patients show significant improvement compared to 33–39% with a placebo. The fundamental principle is to start low and go slow, beginning with half the dose used in younger adults and increasing it gradually. The full effect can take 6 to 12 weeks, so patience is essential. For cases that don't respond to the first medication, there are several options, including switching to another antidepressant or augmenting with other medications like aripiprazole or bupropion. Psychotherapy. A powerful healing tool. Psychological therapy is as effective as medication and can be even more beneficial for older adults. Cognitive behavioral therapy, CBT, helps identify and modify negative thought patterns. Interpersonal therapy, IPT, focuses on relationships and life transitions. Reminiscence. Therapy uses positive memories to restore a sense of identity and purpose. Studies show that combining medication with psychotherapy results in up to 72% sustained improvement, making it more effective than any single treatment alone. Innovative strategies to rekindle joy. Recent research confirms that specific activities can restore the ability to feel pleasure. Physical exercise is as effective as medication for many seniors. Even 15-minute walks can improve mood for up to 2 hours. Adapted exercises like yoga, tai chi, swimming, or chair exercises are safe alternatives. Music therapy, whether listening, singing, or playing instruments, has profound effects on the brain, releasing dopamine and endorphins. Art therapy, dance, theatre, and gardening not only improve mood, but also stimulate cognition and promote social connections. These creative therapies show extraordinary results, with studies revealing significant reductions in depression with considerable effect sizes. The key is to find activities that restore a sense of purpose and meaning. Complementary approaches with scientific evidence. Beyond conventional treatments, several complementary approaches have demonstrated efficacy. Acupuncture, yoga, and meditation can be valuable additions to the main treatment plan. Some supplements like omega-3 and say-me, S-adenosylmethionine, show promising evidence, but must be used under medical supervision due to potential interactions. For severe or treatment-resistant cases, electroconvulsive therapy, ECT, is extremely effective in older adults, with remission rates of 73–90%. Contrary to popular myths, it is safer and better tolerated in seniors than in younger people. The crucial role of family. The family is often the first to recognize signs of depression and plays a vital role in recovery. Family members should learn specific communication techniques. Listen with patience, validate feelings without trying to fix the situation, and avoid phrases like, "you should feel grateful," or "just think positive." Important warning signs include persistent social withdrawal, loss of interest in previously enjoyed activities, changes in appetite or sleep, neglect of personal hygiene, and especially any mention of death or suicide. In these cases, seek professional help immediately. Creating a supportive environment involves physical modifications, improving lighting, ensuring safety, and emotional ones, maintaining structured routines, celebrating small victories, facilitating social connections. Social support reduces the risk of depression by 50% and significantly improves treatment adherence. Transformative technological innovations. Technology is revolutionizing the treatment of depression in older adults. Teletherapy has proven to be as effective as in-person consultations, which is especially valuable for seniors with mobility issues. FDA-cleared therapeutic apps, such as Rejoin, offer additional support for patients who do not fully respond to conventional treatments. Wearable devices and artificial intelligence are being developed for continuous monitoring of vital signs and early detection of depressive symptoms. Therapeutic chatbots are demonstrating a significant reduction in depressive symptoms as a complementary tool. Prevention, the best medicine. We now know that depression in older adults is largely preventable. Structured exercise programs, interventions to reduce social isolation, and proper treatment of comorbid medical conditions can dramatically reduce the risk. Regular physical activity reduces the risk of depression by 45%. Strong social connections lower the risk by 50%. Even simple interventions like correcting hearing or vision impairments have a significant impact on preventing depression. Prevention strategies include participation in community activities, volunteering, intergenerational programs, and maintaining structured routines. Adult day centers, peer support groups, and regular visitation programs are valuable resources. Recent scientific discoveries research from 2022-2025 has brought significant advances. We have identified biomarkers in the blood that can aid in early diagnosis and the selection of more effective treatments. We better understand how the older brain responds to treatment. Neuroplasticity, the brain's ability to form new connections, remains active even at advanced ages. Studies have revealed that depression in older adults involves changes in three specific neural networks: the default mode network, related to internal thought; the cognitive control network, related to executive function; and the salience network, related to attention. This understanding is leading to more targeted and effective treatments. The impact of COVID-19 has taught us much about resilience and adaptation. Although there was initially a significant increase in depression, we also observed the impressive recovery capacity of older adults when they receive adequate support. Prognosis and hope. Depression in older adults has an excellent prognosis when treated properly. Complete remission rates reach as high as 78% with combined treatment. Even seniors with multiple comorbidities respond well to treatment. It is crucial to understand that treatment must be maintained. After a first episode, continuing for 1 year is recommended, after a second episode, for 2 years, and after a third episode, long-term treatment may be necessary. This does not represent weakness, but rather appropriate medical care for a chronic condition. A final message of hope. Depression is not an inevitable consequence of aging. It is a treatable medical condition that responds very well to the right interventions. With current knowledge, by combining safe medications, effective psychotherapy, wellness-promoting activities, family support, and innovative technologies, we can not only treat depression, but also prevent it. Every senior deserves to live their golden years with dignity, joy, and meaning. Modern medicine offers powerful tools to achieve this. It is up to us, as healthcare professionals, family, and society, to ensure these tools are available to all who need them. Remember, seeking help is a sign of wisdom, not weakness. Depression steals joy, but with the right treatment it is possible to rekindle the light of life at any age.